Nigerian living in the diaspora to tell us more and give us his take on the worldwide situation involving coronavirus. A social commentator, Kunle Falowo, joins me now. Thank you very much for your time with TVC News. So for you living in America, that's now, overtaking the epicenter, talking about China, what steps do you see in the country, US now, to combat the spread of the disease?
Thanks for having me. Well, it's been about 1,500 deaths recorded already from COVID-19. I would also want to alert our people in Nigeria that all of these numbers are real numbers. It's not fictitious numbers. They're real numbers. People are actually dying from contracting this virus. It's serious. It's not a joke. It's nothing to be laughing about. This is actually a serious pandemic. Health experts are telling us to hunker down. They're asking us to stay at home. As a matter of fact, there's a stay-at-home order in about 30 states, including Indianapolis, where I live. Schools are not functioning. There's no social gathering. Nothing is actually working, and it's unfortunate because it's starting to look like the COVID-19 virus is steadily taking us to a form of recession. All right, and then one of the problems that we're facing right now is test kits and ventilators. Because COVID-19 is a virus that affects the lungs, you wouldn't be able to breathe well when you've contracted the virus and it's starting to grow in your body. So unfortunately, there's a very small amount of ventilators in the hospitals to help the patients breathe well while they receive treatment at the hospitals. President Trump has recently enacted a Defense Protection Act, which is equivalent to a wartime legislation, which will compel American manufacturers to start making ventilators and sending them to the hospitals so they can help alleviate those problems.
Absolutely. And sorry, Kunle, this is for the treatment of coronavirus in the country. What also of concern now is the rapid spread of this disease in a country as advanced as the US. So there is a curfew, so to speak, or a state of emergency in Indianapolis where you are. How effective has it turned out to be?
Well, Governor Eric Holcomb, governor of Indiana, asked us for everybody to stay at home temporarily until this is over. School, like I said, schools are shut down. Those that are of essential services, healthcare professionals, are the ones allowed to go out and work because they need people to take care of other people that are down with the virus. Essential workers are also grocery store workers. People will still have to eat. They'll have to go to the store to get stuff to buy and all that. They're considered essential workers. Police officers have been asked to stand down. They wouldn't be stopping anybody on the highways or anybody driving right now. A lot of people are actually scared. So most people are at home because they don't want to get outside, and because of the fact that a lot of people haven't been tested, so you don't know if anybody that you're interacting with has already contracted the virus or not, so you're extra careful. And plus with the fact that we don't have a vaccine right now and there's no cure, so it is a problem, so everybody's just on the watch.
Social commentator Kunle Falowo joining us from Indianapolis in the US. Thank you very much for your contributions.